Hi guys. I will be talking about the spread of diseases, also known as a pandemic, as a threat to the homeland security today. I'm gonna go into. I have a lot of information, so I might be looking down a lot, but I just want to make sure I go through everything. And I'm going to be attaching a list of important notes to this video. Yeah. So I'm gonna start off by explaining what a pandemic is. So a pandemic is basically when an outbreak of an infectious disease affects a high majority of the population. So it can be global, and that's what's happening right now with the coronavirus. It's literally all over the world, and it's getting scary. But Homeland Security has a lot to do with this because they are the ones who are protecting the homeland, and they are making sure that the citizens of the U.S. are doing okay. They want to prevent the disease from coming in and out. So I'm gonna go into how the DHS gets involved. So other than the secretary, you have the public affairs, you have science and technology, health affairs, U.S. Customs and border protection, FEMA and TSA. With the public affairs, that department is in charge of letting the public know what's going on without trying to scare us. They're in charge of letting the public know what's going on, basically. Science and technology, you have the scientists trying to figure out what they can do to help stop the virus. What's the best technology that should be used to figure out what's going on, how to make it stop, if there's any technology that they can use and give to the hospitals to help decrease the spread of the virus. Within the health affairs, you have people in the medical field who are trying to team up basically with all hospitals in the world, trying to just save a lot of lives and save a lot of lives and kind of just really help the ill. Within the U.S. Customs and Border Patrol and Protection, you have people, what they're trying to do is they are trying to limit who's coming in and out the border, so that way they don't have, because you don't know who has the virus. So that's another way that they're trying to prevent the virus from spreading, just to continue to spread. They're trying to slow it down by limiting who's coming in and out the border. Same with TSA. They're just trying to limit who's coming in domestically, internationally. And FEMA are the ones cutting the checks. They're cutting the checks so that way we can have more resources and and more opportunities to have access to a lot more research, because it's really hard to detect a virus, to know when a virus is going to come. It's really hard. So we need we need better planning and protection and know how to prevent a lot from occurring. So with that being said, I'm gonna go into the CDC, because the CDC has a lot to do with this as well. They play a huge part. So the CDC and prevention, they share their data and their findings with the DHS operational planning team. So that way, whatever they find there, they communicate with DHS and let them know, hey, make sure that everyone's on the same page. Just to have a great flow of communication going on, and that way the public affairs, if by the CDC teaming up with DHS can let their Department of the Public Affairs know what to tell us, because it's just like a chain of communication. So how do we know the likelihood of it being categorized as a pandemic? First, you got to realize that there's a huge number an increasing number of human cases of people getting sick. That's number one. When you start seeing a pattern of people getting sick all of a sudden, you don't know where it's coming from. It's like, it's like we got to do something about this. We got to check this out. So if there's an infection in the world and it has the characteristics of a virus, DHS should definitely care, even if it's not like, it doesn't seem to be, if it doesn't seem to be something urgent, it's like a pattern. They definitely have to check that out. So a couple of steps that the CDC intervals, what they go into is, first they go into investigation. They're trying to figure out how this started and when it happened, who's involved, the basic 5 W's, I believe: who, what, where, when, why. Recognition is when it's very similar to the realization. They like recognize, like, we have to do something. This is affecting a lot of people in the world. Initiation is not the planning, it's the doing. The acceleration comes after that. And within the acceleration, they try to determine if it's increasing and how fast it's increasing. Same as the decrease. Next step is, after acceleration, is decreasing. Decrease. And that's also them trying to figure out, is the amount of people that have it, is it decreasing, as time goes on. Lastly is the preparation, and that's when they are on it. They're trying to get all of the materials out to the public. They're letting people know, like, you got to be prepared. Like, this is hitting us hard. It's hitting us very hard, so you need to be alert. So that's like the CDC intervals on how they kind of determine what is a pandemic. And so my notes, I have a lot of notes, but don't worry, I'm going to be posting it. Yep. Cool. So now I'm gonna go into a little bit more of the preparation part as well, because it kind of ties into it. So planning is not enough. Yes, you can plan. It's good to plan because you would know what to do. But when it hits, you have to have like an immediate blueprint, like what to do. Like, your planning has to be like top notch, but you have to review it. You have to have proper planning, a lot of proper planning. So I'm gonna go into, I have 2 examples, but I think I'm gonna do the first one first because it kind of like goes off to what I just said. Proper plan, communities practice. Okay, so communities, they have to practice emergency procedures and ensure that the emergency plans allows their plan to actually work. Many emergency scenarios require evacuation. That's usually what it is. If something happens, everyone's like, we gotta go. But you don't really think about how you're gonna go, what, like, you going, like, what, like, how, like, if you're gonna go by car, you have to think about what time to leave because of the traffic. You don't want too much people to be on the road, stuff like that. So these people who are part of the decision support system, they sat down and they created a great system that worked back in 2005 in Georgia, and I'm gonna go into that as well. But you need to have an evacuation in place, but it's kind of hard, like I stated before, for pandemics and bioterrorism, because you just never know when they're gonna happen. But upon detection, for example, officials, they have to evacuate the threatened population, which usually is, in this case, for the spread of diseases, it's the people who are sick. So you have to isolate them. Like, we are in quarantine. I always pronounce that word wrong, so bear with me. But you need to evacuate them and keep them isolated. and you need to have a dispense medication area for that population. So federally, this is where, when the federal officials, the stockpiling, and they're responsible for stockpiling and delivering the materials. The state is responsible for distributing the materials to the community, so to the actual community members. I have a pamphlet. I don't have it with me right now, but in Boston, they have a bunch of people walking around handing out pamphlets, telling people, make sure you're washing your hands, make sure you have gloves, sanitize as often as possible. And I think that was a really, really great idea, because not a lot of people have access to the internet, especially the older generation. They don't have access to the internet, or they don't know how to use a computer. So it's good to have an actual like pamphlet to kind of have in your pocket. So that was, when I was looking into that, I'm like, oh yeah, they definitely did that in Boston. Also, dispensing. Local officials, they are in charge of dispensing and the treatment itself. So, in today, right now, you have different areas in Massachusetts. I'm sorry, I'm talking about Massachusetts because I'm from Massachusetts and I've been seeing it. Right in Dorchester, one of the hospitals is a designated corona testing area. So anyone who's having any type of symptoms, they're sending them out there. That's the population. That's the area that they chose, which is really good. But I believe it's really good to have that, because we don't want the spread of the disease to happen, to keep going. So by having a set location to go to is 10 times better, and it's just more efficient. So it makes a lot of sense to me. So going back to the evacuation plan, so the decision support system, what they do, or what they did, they really make sure that when it's time to evacuate, well, one of the things that they did when it was time to evacuate, they carefully drew out maps of the city where people need to go. They thought about the access route. They thought about planning that. They thought about the times to avoid traffic. They thought about the best times to reach people, and when people need to get out as soon as possible. All those things come into play that you don't necessarily think about right away. You just, you hear like, oh, we got to go. You just pack your stuff and go, but you're not realizing that everyone else is also trying to go. So having that in place is wonderful. Another thing that is in place right now actually is called the risk assessment tool. So it's used by the U.S. government, and they process data gathering, discussions, and consensus building. Some of the resources are a lot of the resources are specific to the influenza, because that was the latest pandemic that occurred. In a couple years, we're gonna have some information about the corona, but what they do is they have a lot of webinars in place to help people kind of know what's going on, teach you what you should do, what you shouldn't do. The information is definitely out there. They believe that educating the population is a great way to prevent a pandemic, and not even just prevent it, to slow like the disease from spreading. And another thing that they had a mental health resource like online, which I thought was really good, because this is really stressful for people. A lot of people's lives are changing because they're not able to leave their house. They're not able to work. They're not able to go to school. School systems are shutting down. It's getting a little people are getting just anxious, and having a mental health resource online to And not even just online, by phone call too. They're online. They like give you a whole bunch of phone numbers that you could call. You have counselors on call ready to talk to you. I think that was honestly a great idea in place within the the risk assessment tool as well. If it's global, the United Nations, they get involved because it's not just the US. And I honestly think that it's very smart of them to get involved, because that way everyone can be on the same page and help defeat the spread of disease together. Because it's scary, you know? Like, we rely a lot on science and biochemistry, you know, to avoid bioterrorism, but it's kind of scary and hard to get rid or like plan what to do when a pandemic hits, because you never know when it's going to hit. So what another thing that is on the bad side about the spread of diseases is we don't, well, not we, well, like, we don't know as well, but like the government as well, like DHS, we all lack awareness of it, which is hard, because when the spread of diseases, when a pandemic occurs, it's all about, it immediately affects the decision making. Like, if we don't know what we're deciding on, because we don't know how it happened, how it occurred, we're making decisions based on what we think, but we're not experts. So it kind of puts everyone like on edge, on ease. Is not, like, everyone's health is basically in danger. So it's really important to listen to the medical experts, listen to the doctors, listen to what CDC says when they put online. It's really important. Yeah, so back to my decision support system. I believe I did talk about this, but I just want to say it started in 2005, the group. Georgia, in the state Georgia, DeKalb County was the first and the only county to use the system. And when I was talking about the evacuation planning, what they did was they had a plan of the facility location. They had a plan to lay out, who's gonna be at what station for what if this occurs. They had staffing. They had people on call. They were on it, and they concluded that by having the highest dispensing center, well, they were the highest dispensing center in Georgia, but by having a plan and system, they were their reliable patient transport. Oh my gosh. Oh, sorry, my battery came up, so I thought I stopped the video. The reliable patient transportation system that they put in place at the time to help with the move of if something was to hit with the hospitals, it improved the effectiveness of all emergency plans. So they proved that it does work. By having this decision support system in place, it does work. Yeah. So I believe that's all. I believe I hit all keys. This is a lot of information. I'm definitely going to post all of my notes on the PDF. But how I would like to end this is, we definitely need to use vaccinations. We need to use clinics. If you're not feeling well, definitely please reach out to your closest clinic. I think clinics are still open. But yeah, use hospitals and clinics to access and estimate the impact of the threat. That's what they've been doing. The DHS and CDC, they rely a lot on the hospitals and what they say. So if they have a huge group of people coming to the hospitals for this, then they'll say, like, this is a threat. This needs to be taken care of. we need to educate, which we are. So I'm going to say we need to continue educating the population, because I feel like the government has been doing a great job with that. So continue educating the population, reduce contact. That's what we're doing now. Immediately seek medical help if you're not feeling well. And just be cautious. Wash your hands. Just disinfect your area. And that is all. So thank you guys.